Hi, it's me, Dr. Sheila Doby. I wanted to create a quick video for my friends, family, and patients just to keep you safe. A couple of basic principles, but just to get you thinking about how to kind of look out for yourself out there. So first of all, let's talk about viruses. Viruses have been out millions of years. They're not going anywhere. There's good viruses and there's bad viruses. And we know COVID-19 is a bad virus. So this is something that we want to avoid if we can, but obviously if you do get it, there's things that you can do and precautions that you can take to get yourself as healthy as possible. So the first thing is the virus corona. Let's talk about how big it is. So viruses, if this was a hair, so this is, I'm just doing a comparison. If this was a hair, the coronavirus would be this big. So basically you can't really see it. And you just have to, and that's what makes it so difficult, because you can't see it. It's difficult to avoid because you don't know if it's on a surface or not because you just can't see it. So that's what makes this completely challenging. Now, how do you get it? The coronavirus has to actually enter your body. How does it enter your body? It enters through three ways. Number one, the eyes, the nose, and the mouth. So that's why when I'm out and about, I like to wear just routine glasses or sunglasses. Now, I can't tell you how, the science behind this yet, but this is something they're talking about. So I'm not a medical virologist that gives you the exact science of it. But me, these are the things that I do just to keep myself. So I just wear glasses when I go out. In my dental office, where there's more likelihood to be things in the air, I actually wear goggles just to make sure that nothing does get in through my ear. But even if something did, we don't know how much is needed to actually cause an infection. Second thing is the nose. So the virus can get in through the nose and through the mouth. So these two you can take care of by wearing a mask. And this, I wear the glasses. So let's talk about masks. Are masks important and why, and what's the concept? Let's talk about how viruses get to these places in the first place. Just picking up my board. Viruses get through a couple of ways. One, sneezing. Two, coughing. 3, talking. 4, surfaces. Okay, so these are the modes that they know of at this point, and some of them are relevantly new. They didn't know about the talking thing before. So let's talk about each one. Sneezing, if you sneeze, right, it actually can project out for many feet, and there's a lot of stuff on YouTube where you can actually see. I'll see if I can post a link, or depending on how I post this video. But sneezing can actually be lots of, like when someone sneezes, it's a lot of spread. So think about it like a squirty bottle, and you go chick, right? A lot of spread out. The second is a cough. It's not as much as a sneeze, but it's a lot of pressure goes in and the virus comes out. And this is a new one that came out recently when they've been doing some research, is talking. So when somebody's talking, the virus can actually come out just from a normal conversation out into the atmosphere. And then surfaces. For example, an infected hand touches this, somebody else comes and touches this. Now that person has a virus on their hand. They can touch their eyes, they can touch their nose, they can touch their mouth, because this was contaminated, right? So those are the four main ways. Now, if you know this is how you avoid them. If somebody coughs or sneezes and they're right here, then obviously you're going to have a big amount of virus. Which brings me up to the next thing, which is called viral load. That's the amount of virus, right? So if you're like, somebody's quite far and they cough and then a little bit of virus floats in the air, that viral load is a lot less than if somebody coughed or sneezed right in your face. And also, if somebody wore a mask and you wore a mask, you're more protected because you have less viral load. And they don't know how much viral load you need to get infected. Like, let's say, does a little bit of that virus get into you, and then now you could get a full-blown infection, or do you need a huge amount of that? So the key is just, ideally, it would make common sense to like have as less viral load as possible, so that if it's a little bit, maybe your body can kind of deal with it a lot easier than a mass big fat influx of virus. So that's just common sense, I'm assuming. So these ways. So that's why wearing a mask, if you put a mask on, you are going to potentially protect yourself and you know, not 100%, but at least protecting yourself from that viral load. Now, let's talk about risk factors and death potential. So when you turn on the news, you see there's a lot of people dying and it freaks you out. You have to take precautions, but you also can't be like freaked out and scared, because if you're stressed out, that actually decreases your immune system because your body's just fighting that fear, and that's a whole conversation. But you got to kind of take precautions and be smart about it, but not be living in fear, so that it actually adversely affects your body, because stress can be like a silent killer in itself. So let's talk about high-risk people. Now, there's a group of people that are more high risk than others. Now, that doesn't mean that if you could be a 25-year-old and healthy and still have a major complication from coronavirus. But these are the people that are more at risk. These are the elderly people, the older people that might have other issues like high blood pressure and heart issues, people that have heart issues, and high blood pressure and obesity. These are risk factors. So obviously if you have these, and along with other things such as lung issues, because they're seeing that the virus affects the lungs quite a lot, but it's also causing other issues once it enters your bodies, damaging other organs. So these are the risk factors. So if you have these, you have to take extra precautions. And this is why if you're elderly, a lot of in the homes, the elderly people homes are not allowing visitors because there's a higher death rate. Now, if you're a younger person and you're going out and about, you could catch it and give it to somebody who has an elderly parent, and you don't want to cause an issue there. But it's important to know, if you get coronavirus, it's not a death sentence. They don't know the exact fatality rate, but it could be as low as, let's say, 1%. But the side effects is you don't know what, if you get it, the other issues that could be. But so if you get it, you just obviously call your medical doctor, and we can have a separate conversation on that. I've been talking to a lot of experts on what to do when you get it. Sorry, if you get it. But the key is you just have to try and also get as healthy as you can during this period. So a lot of people are at home. Use this time wisely to work on your health. Use this time to get healthy. It takes about 3 weeks, and you can actually eliminate blood pressure, which is one of those factors that could cause complications in coronavirus. So there are things that you can do. Start eating more fruits, more vegetables, cutting down more on the dairy, less meat, no sugar, and start like doing exercises like walking. And like there's a YouTube video, and it's called Walk With Me, and you can just literally walk in a very small amount of space, and you're just kind of doing exercises and burning calories. So it's never too late to start, because a lot of people think, oh my gosh, they have diabetes, they have high blood pressure, and they're like, oh, I'm high risk. But do something about it. It's never too late to start, and this is a really good time to start working on your health, because you can just shift that risk factor. So I've talked about the risk factors, how you can get it. Information. There's a lot of fake news out there. So don't bombard yourself with listening to fake news. CDC.org is a good website that just kind of gives you up-to-date stuff. And on the coronavirus, things are continuously changing. So therefore, you kind of do want to be up on that. Don't get your news from WhatsApp. Don't get it from your friends. They aren't viral experts. They're not COVID experts. Definitely no aunties and uncles and the rest of us are not experts. There are people that actually study this information, and they know things that we don't know because they're working on it. Which brings me down to innovation. It is a difficult time right now. So a lot of people think, oh my gosh, they're never going to go out anywhere, and there's no light at the end of the tunnel. But what you do need to realize is the whole world is working on this right now. People will innovate. Innovations are happening all the time. Like I was reading, Harvard is coming out with a mask that has an indicator that shows you if you have the coronavirus. There's going to be better testing, because it's a world problem. And wherever there's a problem in the world, there's a need. And wherever there's a need, there's going to be companies working on it, because they know they're going to make billions of dollars if they solve problems. So the good news is people are working on stuff, but innovation generally takes a couple of months to get through. So there are going to be better masks. There's going to be better things out there for us to wear when we go out. So you just have to kind of wait it through. And also even how to treat the virus. Like, you know, there's different medications. They're going to figure out that in a better way. What's the science behind that? So don't feel like this is going to go on and on forever. Yes, it may go on for a really long time, but innovation will happen that will make your life easier. And also just make sure if you are feeling lonely that you are speaking to some friends and family, because the depression rate and the anxiety rate has really gone quite high. And you need to know that there's people out there that do care. There's a lot of organizations that can just help you get through this. So don't suffer through this alone. There are people out there that care about you. So the final thing I want to talk about is mask and glove safety. The mask. When you are wearing a mask, you have to wear it covering your nose and your mouth. There is no point of having it like halfway down here or like hanging. If you're out and about in public, you want to be wearing a mask. And when you take the mask off, take it out from the sides. Don't touch the outside, because think about it. When you're walking around, and if there are particles, that's where they're going to be, is on the outside. So when you take the mask, you just take it from here and then drop. And drop it in a container that you can just put a couple of masks, and then you can just wash it in that, like when it piles up. So always have at least about 2 or 3 masks so that you can just wear it and take them out. And there's certain things that you can do to disinfect your masks, your cloth masks that you're using. You can put them in the washing machine. You can also iron them in a really hot heat. But you also have to make sure that the kind of mask that you're wearing is a good mask. Now think about it. Think about if you had a squirting gun, right? And you had a piece of tissue and you just squirted it. Obviously that thing would get wet, and you would get like things going through. Think about the virus as a tiny, tiny little thing. So if you have a mesh, let's say your mask it's like a fence, right? You know those fences, they look like this. And the virus is this big. It's gonna go through the fence, right? So you have to be making sure you're wearing a mask that has a lot of like layers, and so that it basically has so much interweaving that the virus can't kind of go through. So the kind of mask that you wear is important, and that's something that I can talk about in another video. So that's the mask thing. And then the final thing I want to talk about is gloves. When you have gloves on, it's not protecting you from the virus per se, because the virus doesn't go through the glove. Remember, the virus has to go either through the eyes, the nose, the mouth, right? So it's not going through the skin. So people think they're wearing gloves and they're like safe, and then they touch their face and then they touch their nose and stuff. Now, if you have gloves on and you touch something that is dirty, let's say the pen, with a clean glove, that glove is now a dirty glove. So now you have virus on your glove, and then you're touching your other things, and you're touching your nose, your eyes. That's how it can enter the body. So therefore, if you are going to put gloves on, your gloves should be an indication to you that because you have gloves on, you can't touch your face. That's the only way that a glove works. Basically, it's a reminder, do not touch your face. So if you go to the store, you touch a bunch of dirty stuff, you do everything, then you go home, then you safely, there's a special way of removing gloves. We can do that in another video, or you can watch it on YouTube. Take your gloves out and throw them out. That's basically an indication that your hands, because before you put your gloves on, your hands should have been washed and cleaned, so now your hands should be clean. Doesn't still mean that you can touch your face. You still have to wash your hands. Be mindful of surfaces that potentially could have coronavirus on them. So we're looking at doorknobs, we're looking at doorbells, we're looking at things that you're touching in the store, gas pumps. This is where you could potentially touch something and then introduce it into your body. They don't know, they're always kind of talking about different numbers. Sometimes I hear it could stay on a cardboard box for this amount, could stay on this amount. But just to be safe, you don't know, because you don't know when that virus got there. We don't know the exact science of it. So the best thing to do is just, like, if you're going to touch surfaces, make sure you wash your hands. And the overall view is, number one, if you're out and about where other people could have been, with a short period of time, wear a mask. Cover your nose, cover your mouth. You can wear glasses too, because that's science they're not sure about right now. Make sure you are washing your hands frequently, especially if you're touching surfaces, and avoid touching your face and your eyes and your nose, basically those areas. And that way you should hopefully stay safe and stay healthy. And remember, it's not a death sentence. If you do catch it, there are precautions that you can take, and we can talk about that in another video. And I'm doing the best that I can to educate my friends, my families, my patients. So make sure you do the same, you know, share the video, or have a quick discussion on the phone. Just say, hey, this is what I've learned. And just the key right now is just educate everybody, because what you want to do is you want to stay as healthy and as safe as possible for as long as you can. Because if it does get to the point where a lot of just everybody's like around you has got it, and you do happen to get it, you're at the position where the science is there to help you treat it effectively. Your body is there to help you fight it correctly, and you're just in a better position. So stay educated and stay safe. And hopefully this video helped, and I will do some more later for you.